right, so this last part, we're actually going to open all of our supplies, clean the wound, and dress the wound. All right, so the first thing I'm going to do is open my little sponge boat, and I'm going to open it very carefully. I'm going to remove all the adhesive area first to get it good and open. And keep in mind, with sterile, the only thing that's going to be sterile in here is from that adhesive part out, so that's what I can touch. I'm going to pull back, be very careful not to reach my hand over it, and I'm going to set that down. And then I'm going to grab my solution, and this is never been opened. I'm cracking the seal. I'm going to open it, and up away, I'm going to pour enough that it's going to saturate the gauze, but it's not going to be sitting in water. All right, next thing I'm going to do is I'm going to open these things that are back on the back side so I don't reach over them. Again, I'm going to go through and I'm going to open up the adhesive. These are very tricky because they like to tear, so make sure you have it good and open. I'm going to make sure my arm, oh, and that one tore. So I'll make sure it doesn't hit my table and stays there away from my blue edge. I'm going to open this one. And this one I'm actually going to put this way so that I'm not reaching over my sterile field on that gauze. And I'm going to pull that open. My drain sponge, which is a lot easier to open. And open my ABD pad. And this one you just have to make sure that it doesn't fly off your package when you pull it open. Okay, I brought 2 culture swabs with me because they tend to be a little tricky and kind of want to fly off the table. So I'm going to, first of all, open my gloves. They're my sterile gloves. Make sure you get the correct size for you. And then before I put my gloves on, I'm going to take my culture swab and I'm going to dump my culture swab onto my sterile field. Now remember, whenever we're opening this, the sterile field I have is within an inch from what's on top of my table. So with these culture swabs, you want to open up the top, make sure you have a hold of the swab and the little tube, pull it open, and then I'm going to drop them right in the middle, and they are within my sterile field. Now I'm going to go ahead and don my sterile gloves, and I'm going to do this very slowly so I make sure my swab stays on my paper. I'm going to back up, which I can't, so I'm going to scoot over so that I'm not over the top of my sterile field. I'm going to put my glove on. Gloves are on. Now I know I can't touch anything that's not sterile. Okay, so I'm ready to clean first, so I'm going to start. And what you have to make sure you do is angle your table where your elbow is not going to be all over your supplies. So I like to use my foot and just angle my table so that right now all I can have to do is reach for my little wet gauze. I'm going to carefully pull it out of my little gauze boat, wring out any excess solution. I can use both hands here. I'm going to make a little tuft because I don't want my fingers to touch the patient. Well, sterile principles are we're going to clean away from us first. So I'm going to start at the top. I'm going to place the sponge down and clean straight out away from me. And then I'm going to move it around because I don't want to pull that sponge right over a place I've just cleaned. You can use your other hand to help make sure you don't pull all your gauze out. And the amount of gauze that you're going to use is going to depend on the size of your wound. For the second one, I'm going to place right on top, and I'm going to clean away and over around the top of my drain. Now this part, I have to actually lift up the drain. And you have a couple of extra gauze here. So what I'm going to do is I'm going to pick these up. Both hands are still sterile. I'm actually going to lay that one right there because it's sterile. I've got a gauze here that I'm going to lie on top of my drain and use it to pick my drain up because my drain is not sterile. And then I'm going to place this gauze and clean underneath the drain and away. And then I'm going to take them both and never switch hands. And now I'm ready to clean the side closest to me. Bring it towards me and around to my trash. And again, always making sure I'm not over the top of any of my other supplies. That one caught on a suture, so very gently I'm going to remove that. I'm actually just going to toss that one and start again because I don't want to lift up and then put it back down. Caught on a suture again. Gotta be very careful because you don't want to just snag your sutures. Okay, so now my incision is clean. What I want to do is I want to take a culture because you always want to take a culture from a clean wound. So I'm going to come over here. I'm going to grab my tube and I'm going to go ahead and open the top, and I can just set that top down. I'm going to grab my culture, and right in the middle of the wound I'm going to go and I'm going to just roll it around. Place it inside of my tube, and then I'm going to drop that back down. Okay, now I'm ready to dress. I'm going to adjust my table a little bit again so I can reach a little better. And this is going to depend. How many gauze you use depends on the size. This is a fairly small wound, so it's not going to take a whole lot of gauze. But what I want to do first is I want to lay a gauze on top. I'm going to take my extra little, that's actually 2 gauze there, which is good because it's good and absorbent, and these are very thin. I'm going to take my drain sponge, and I'm going to take the extra gauze. I'm going to lay that extra gauze right on top of the drain, lift it up, and I'm going to take my drain sponge, and there's a couple different ways you can do this. I'm going to fold mine in half. Oh, my fingers don't want to work. Kind of spread it open and then lay it down. And the thing is, you don't want to lay it down and then have to pick it back up. So where it goes, what it touches, just leave it there. And then I'm going to lay my drain back down, and I'm just going to leave that gauze right there as well. And now I'm ready for my ABD pad. And the ABD pad has a nice little blue line on it. And the line should always go in the same direction as your incision. So I'm going to lay that down, and again, I'm not going to lay it down, pick it up, move it around. So right now it is covered. I'm going to remove my gloves at this point because I can't tape with gloves very well. And that's okay because everything that's sterile is covered. I'm going to adjust this a little bit so that I can tape. This is a large ABD pad. Now to tape, you just want to kind of eyeball the size, and you're going to tape the side closest to you first. It's almost like you're sealing it up on the area that you're going to be reaching over. So I'm going to tape the side closest to me, and then I'm going to tape the top. I'm going to tape the bottom. And then I'll tape the side farthest away. Now at this point, you're assessing your patient, you're making sure they're comfortable, explain to them what you've done, and I'm going to take a pen and I'm going to put my initials, date and time on the dressing, or actually what you can do is take a little piece of tape, stick it on your table, write your initials, date, time, and then take that little piece of tape and place it on your patient. Make sure you fill out all the information on your culture swab, bring it down to the lab, cover your patient back up, put the side rail up, and you are done.